welcome. We would first like to thank you for agreeing to be a part of this unique initiative. It seeks to address the concerns in people's minds with regards to COVID-19 vaccination and living in the new normal. India is just about recovering from the COVID-19 pandemic and is restarting again. This period of COVID infections has been tough and the challenges haven't quite gone away just as yet. The risk of COVID infections continues as we unlock and start to resume our lives. Today we have with us experts to share with you some advice on how to continue living long and healthy with COVID vaccination. Today we have with us Dr. Bhansali, consultant physician at Diabetes and Heart Clinic in Howrah. We also have Dr. Prabhakar Shetty, consultant interventional cardiologist, chief of cardiology, Columbia Asia Hospital in Bangalore, and also Dr. M.A. Karmur, consultant diabetologist at Saurashtra Diabetes Center in Rajkot. Well, Dr. Bhansali, to you first. Does the vaccine protect against the new variants of COVID-19? We do have the UK variant, the South Africa variant, and also the Brazil variant.
COVID-19 vaccine, this Moderna vaccine and Pfizer vaccine, they are effective against South African variant as well as Brazil variant. But still we don't know about Covaxin and Covishield. There is no clear idea about whether they are effective or not, but most of these vaccines, till date there are so many mutant variants and they are effective against most of them because they are effective against the spike protein of the COVID-19. So most of them are effective, but we have to learn a lot whether new variant comes and whether these vaccines are effective or not. Then we have to modify our vaccine to include new antigenic character of that virus.
Right. Dr. Prabhakar Shetty, I'm nervous about the vaccines. Are the COVID-19 vaccines truly effective as they were developed in less than a year?
Even though many of these vaccines are developed over a short period of time, there does not appear to be any major compromise of the vaccine development protocols. So you need to understand that the vaccines are developed in a short time, but the technology has been there for a long time. So it has been almost 20 years since people have been working on these technologies. All the major vaccines have undergone a major phase 3 clinical trial with almost 40,000 patients in each trial, and they've all been found to be very effective and safe. So there is nothing really to worry. Now, yes, we have to wait for some more time to see any of the side effects because we need to monitor this for a longer time. Now, you might have heard about the blood clots with the AstraZeneca vaccine, but first of all, it has not been proven to be due to the vaccine itself. And secondly, even if it is true that the number of people affected by these problems are very small and the vaccine benefits clearly outweigh the risks. So I don't think one should hesitate. Now, if you look at Israel has vaccinated almost everybody. I think everybody should take the vaccine as soon as possible. So if you're able to achieve maximum population vaccination in a short time, we're able to prevent mutations of the virus. So then we will be able to succeed. So I don't think one should worry at all.
Dr. Karmur, how long after one is inoculated, once both the vaccines are through, does it take for it to be effective?
This is very important to know that when a person will develop enough antibodies to protect himself from the COVID-19 disease after taking the corona vaccine. We have seen some of the messages being spread via various sources that a person has developed COVID-19 after taking the corona vaccine. So my friends, it is very important to know that when a person will develop enough antibodies in the circulation to protect themselves from the disease after taking the corona vaccine. So friends, it takes 2 weeks after taking the corona vaccine to develop enough antibodies in your circulation to protect yourselves from to COVID-19 disease. Though there may be some variation, it may vary from person to person. Some people may develop earlier antibodies, some people may develop more antibodies, some people may develop less antibodies. But studies have found that most of the people will develop enough antibodies after 2 weeks of second dose.
Right, Dr. Bhansali, to you, will the side effects be any different for people who might be suffering from diabetes?
No, side effects are not different from people who are suffering from diabetes, because we know that if diabetic patient get COVID, there are more serious complications. So diabetic, hypertensive and any other comorbidities patient, they should take vaccine. So there is no contraindication that diabetes should not take vaccine. Diabetics should take vaccine because it will prevent him from serious complications of COVID-related comorbidities and complications.
Right, Dr. Prabhakar Shetty, why should people with heart diseases or those who have perhaps had a heart attack or even a stroke get the COVID vaccine?
Right from the beginning, we have realized that people develop COVID infections, but people with underlying diseases like heart disease, diabetes, high blood pressure, stroke, cancer are the people who develop more severe infections. So vaccines help in not only preventing the chance of infections, but also they will reduce the severity of infections. So I think these people benefit more than other people. So patients with heart disease, including heart attack or stroke or diabetes, hypertension, obesity, lung disease, they should all take the vaccines on a priority basis, and that will certainly help them.
Right, thank you so much, Dr. Shetty, for busting all those myths regarding the vaccine at this point in time. We're taking a very short break. We'll be back with a whole lot more on our special show. Welcome back. You're watching our special show, Living Long and Healthy with COVID Vaccination. At this point, I would urge our viewers who are in the eligible category to please go get a COVID shot. We have with us our expert doctors to bust all the myths. To Dr. Karmur now, how will the vaccine affect my blood sugar levels? That is a concern amongst many people.
Let me make it very clear from this platform that corona vaccine, both the vaccines available in our country, Covishield and Covaxins, they do not affect your blood sugar level. They do neither increase nor decrease the blood sugar level. There are some of the side effects like fever, malaise. If you develop such type of side effects, that may affect to some extent your blood sugar level for very short period. It may increase to some extent for a very short period. So if you have a glucometer, regularly you might be checking your blood sugar level. So just you can have a look of your blood sugar level after taking the corona vaccine.
Dr. M.L. Bhansali, is the vaccine safe for people with gestational diabetes?
It is safe in gestational diabetes and all the pregnant ladies, because the study has not been done in pregnant ladies. But after vaccine came into force and people started vaccination, then so many pregnant ladies has been given corona vaccine, and it is found to be totally safe in gestational diabetes also. So there is no question that pregnant ladies, there is any contraindication to vaccine. They should get vaccinated to prevent serious complication related to COVID-19.
Right, Dr. Prabhakar Shetty, is the vaccine safe for people with pacemakers?
Yes, it is safe for the patients with pacemakers and implanted cardiac defibrillators. It's also safe for people with coronary stents and artificial heart valves. In fact, these are the people who have underlying heart disease and benefit the most compared to people who do not have such problems. One more point I want to add here, that people with heart disease, whether pacemakers, defibrillators or anything, or on any of the medicines, they need not stop any of the medicines before they take vaccine. including the blood thinners. Even if they are on strong blood thinners like anticoagulation, like warfarin, there is no need to stop the medicines as long as the blood thinner levels are therapeutic. They are not out of the scale. So they may just have to apply the pressure at the site of injection for a couple of minutes more, but there is no need to stop any of the medicines before the vaccination.
Dr. Karmur, is it important for one to check with one's doctor regarding diabetes medicines before going in for the vaccination?
You should not stop your medications for diabetes, including insulin if you are taking for diabetes management on the day of corona vaccine. If you are going after breakfast corona vaccine, for taking corona vaccine, I would advise you take your regular medicines for diabetes. If you are taking before breakfast, after breakfast, you can take your insulin also if you are taking. Take routine breakfast, then you can go for vaccination. If you are going after lunch for corona vaccination, you can take your all medications before lunch, after lunch, and then you can go for vaccination. But here I would like to advise that if you are going for corona vaccination, for example around 12 o'clock or 1 o'clock, and you have not taken the lunch, I would advise that you keep some form of sugar like glucose tablet or some form of candy, so that at the vaccination center, if you develop hypoglycemia, or in observation center, as we all know that we have to wait 30 minutes after taking corona vaccine. If you develop hypoglycemia symptoms, or if your lunch is delayed and if you are coming to home, on the way, if you develop hypoglycemia symptoms, you just take the sugar which you are having.
Dr. M.L. Bhansali, we have only two options in terms of the COVID vaccine in India, and there's some amount of confusion among some people about which vaccine should they be getting. Does it really matter as to which vaccine one gets?
It does not matter which vaccine one should get because both vaccines are effective. And in India, we have not got any major side effect. Side effects are only of minor nature, that is local pain, sometimes fever, myalgia, fatigue, and that lasts for a day or two. So it does not matter which vaccine you get. You can get either of the two. Both are effective and both are safe till date. And there was concern about blood clotting with this Covishield, and that has been unfounded. Now EMA as well as UK authorities, they have cleared that this clot was not related to this AstraZeneca vaccine. So that has been also cleared. So both are safe and effective.
But doctor, the Covishield apparently is not valid for patients who are above a certain age group. It's not that effective. Is that right?
No. It is effective at all age group. But regarding this Moderna and Pfizer, they are recommending that Pfizer is recommending that below 16 they have not studied, and Moderna have not studied below 18 years of age. So officially they are not recommending in younger age group than 16 and 18. But there is no concern that above 38 or below 38 there is side effect. No,
Right,
that is not there.
Right, Dr. Shetty, to you now, can I choose which vaccine I should be getting?
So I think in India we have only two vaccines available. As I understand, only in certain government setups you have the option to choose the vaccine. But for most of us, I think the option is not there. Even if you have an option, we really do not know which vaccine is better. Unless you have head-to-head comparison, it's difficult to say which vaccine is better. So it doesn't really matter. I think both the vaccines are good. As mentioned already, Covishield has a lot of data, and Covaxin also comes from people who are very experienced in the field. So I don't think it should not matter. Any of the vaccines we can use.
Dr. Karmur, my last question to you would be, when can one stop wearing a face mask?
As we know that after taking both the doses of corona vaccine, after 2 weeks, 70 to 80% of the people will not develop the COVID disease. There may be 20 to 30% of populations which may develop the disease, but it is very, very important that they will develop very, very mild infection. The disease would be very mild. So friends, even after taking the corona vaccine, if it is 2 weeks or even more than that, you may develop mild disease, or sometimes you may develop silent infection in your body, but you are likely to transmit the coronavirus to others. So friends, it is not the time. We all should take all the precautions what we are taking right now, like properly wearing the mask, keeping the social distance, and frequent hand sanitizer even after taking the corona vaccine.
Right. Dr. Shetty, my last question to you would be, when can we expect other vaccines to make their entry into India?
So it's less likely in the next few months. I think, because the vaccine, the Moderna and Pfizer vaccines have some issues with storage, it may be difficult to arrange the storage facility to have them. And I think if these vaccines which are available with us are very effective, then there is not even a need for getting other vaccines from the other country. I think they should be good. If we are able to vaccinate maximum people in a short time, then we will be able to achieve a lot more reduction in the incidence and control of the infection.
Right. Dr. Shetty, if you can just differentiate for us and our viewers the difference between Johnson & Johnson and say the vaccine that we have at the moment, besides the fact that we only need 1 shot of Johnson & Johnson and we need 2 shots of the vaccine that we have currently in India, what is the difference between the two?
So I don't think there is a major difference between them, unless, as I told earlier, difficult to compare the various vaccines. But Johnson & Johnson vaccine has been shown to have some efficacy against the South African mutant. But I know the same has not been shown with AstraZeneca. So, but still I think it is not possible for us to say that which one is better. So I think if that Johnson & Johnson makes entry, that will be one other vaccine to use, but we don't know which one is better.
Right. We'll have to wait and watch to find out which is better. We need more data and that requires time. But up until then, please do get yourself vaccinated if you're in the eligible category. Thank you so much, doctors, for joining us on our special show, Living Healthy and Long with the COVID vaccination.